Hi, this is Miss Walton, and today we are going to be talking about the care of the hospitalized child. So, any type of hospitalization is always a stress on the child and the family. For the child, it's a new place, there's strangers, there might be pain involved, could be a traumatic event. So, lots of things happen in the hospital that we have to take into consideration. So, for the family, we think about trauma, they may be scared of the future. What about babysitting for their other children, loss of work or wages, money to cover medical bills? So lots of those things come into play. So, children's understanding of health and illnesses may vary. Keep in mind that it's based on cognitive ability, um, and there are various stages of developmental stages in a child's life that's going to influence that. So, you also have previous experiences that will influence the child. And then there's stressors that are involved. So separation from the parents, loss of self-control and autonomy and privacy, pain and invasive procedures, and fear of injury or disfiguration. So, keep in mind that young children have limited knowledge about the body and its relation to health and illness. The child's understanding is based primarily on their cognitive ability and developmental stage and previous experience. So the toddler and preschool age child, as far as they're concerned, it's very, very common for them to regress. So their imagination can create greater fears rather than the truth. So, maybe a preschool child who has been potty trained and using the toilet regularly regresses to where they're soiling themselves. So you just have to keep those things in mind. So for this activity, I want you to identify some common stressors and stressor responses that you might see in the hospitalized infant, toddler, school-age children, and adolescents. And then be thinking about what nurses can do to help minimize those stressors in the hospitalized child. So you can refer back to your textbook and your ATI books for additional information on this. Some stressors for hospitalized infants are listed below. And, keep in mind that infants 6 months and older can feel and sense anxiety. They've already developed an awareness of themselves as separate from their mothers and fathers. And the most common stressor of the hospitalized infant is going to be separation from their parents or caregivers. There's 3 stages of separation anxiety identified below. Um, Infants and toddlers between 6 to 19 months of age display these behaviors, especially if the parent isn't able to remain with the child. There's the protest stage. In this stage, the infant or the toddler is screaming, crying, and clinging to their parents and will resist for others to comfort them. And then you move on to the despair stage, where the child is sad, quiet, and appears to have settled in. They're kind of withdrawn and they'll cry when the parent returns. Then you have the denial stage, and that is where there's a lack of protest when the parents leave. The appearance of being happy and content with everyone, and they'll show interest in their surroundings. In addition to separation anxiety, the child between ages 6 and 18 months can also develop and will develop stranger anxiety when confronted with those unfamiliar health providers. Other causes of stress for the infant are pain from invasive procedures, being immobilized, and sleep deprivation from disruption of those normal routines. For infants, you have the stressor of separation anxiety, stranger anxiety, painful and invasive procedures, and immobilization. So a lot of those responses that you will see are sensory overload and disruption of the sleep-wake cycles, as well as disruption according to their developmental stage. So some things that you can do are use words that they understand, have night lights, um, have appropriate toys. Things for some of these infants would be like a hammer and pounding, help them to be able to work out their frustration. Some things that you can do to help with the fear that these children are experiencing are, encourage the parent to stay. Um, and don't try to cluster their activities because that can increase fear. And then, kind of get in and out as quickly as possible, especially when you're having to perform a procedure. You want to allow them to keep a toy. That's very therapeutic for the child. And sometimes they have to be mummy restrained, but you don't want to use that in toddlers and preschoolers. Sometimes these kids can definitely regress related to, things like sucking their thumb when maybe they don't anymore. So you have to keep all of that in mind. When we think about stressors for hospitalized toddlers, they are the group most at risk for stressful experiences as a result of illness and hospitalization. Separation from parents is the major stressor, and toddlers generally protest vigorously when their parents depart. Autonomy is a developmental task at this age. So you want to allow the child to still have control over certain things, like maybe the flavor of Jell-O. You want to try to keep and encourage the parents to keep a minimal routine for the child, so like reading a book, singing songs before bed, things like that. You also want to encourage the parent to stay with the child because separation from the parents is a major stressor for toddlers. If the parents do have to leave, expect the child to scream and cry for sure. So some stressors are things like separation anxiety, loss of self-control, immobilization, painful and invasive procedures, bodily injury or mutilation, fear of the dark. So a lot of times, the child is going to cry if the parent isn't there or the parent leaves. They're going to be frightened if they're forced to lie supine. They're going to associate pain with punishment, and they may wonder why the parents don't come to the rescue. So the main nursing intervention that you want for toddlers is to make sure that the parent is there and have the parent participate in the care if possible. But remember that some parents may not be comfortable helping, so allow them to leave if they need to. You also want to allow choices to make procedures as painless as possible and explain those procedures. So you may see temper tantrums, if the parent leaves, and that's normal. So, they may ignore their safety and they may just be trying to get control of the situation when this is happening. So keep in mind when we think about the hospitalized preschooler and the stressors that they incur, a child's fear may create a greater fear than the actual truth. So the greatest stressor are their fears: fear of the dark, fear of abandonment, fear of loss of self-control, and fear of bodily injury. Preschoolers may also feel guilty about being sick and view the illness or the hospitalization as a punishment. So they're going to need to be reassured that they did not do anything at all to cause the illness. Some stressors like separation anxiety, loss of control, bodily injury, mutilation, pain, fear of the dark, monsters, etc. also come into play. So, keep in mind for the response, they fear that their body parts will leak out, tubes will be permanent, they may withdraw, they might be aggressive or regress developmentally. Nursing interventions that you all can do are, having the parents there, allow them to have choices, and, try to make the procedures as pain-free as possible. You want to provide explanations of procedures and events at their own level. Have a routine, provide a nightlight or a flashlight. And then, to decrease anxiety, you can always provide them with a doll or safe medical equipment. And it's good to demonstrate kind of some things that you're going to do with the child. maybe using a doll or something like that. Also, anytime you're going to do any type of invasive procedure, it's best if you remove them from, the room that they're normally staying in. A lot of pediatric units have a treatment room, so whether the child has to get a dressing change or maybe an IV or something like that, anything invasive, they will take them out of their safe zone, their room, and take them to the treatment room. So, with a school-age child, just keep in mind that they still rely on their parents and others for support and understanding during stressful events and procedures. Major sources of stressors for the child are, that loss of control, privacy issues, fear of bodily injury, pain, and concerns about death. They also have that separation anxiety. So, some things, that you can help the school-age child with is to encourage their sense of industry. So encourage them to continue to work on their schoolwork or engage in creative outlets like crafts. So you want to let them have a feeling of control. You can do that by offering choices whenever that's possible about their physical care. And that's going to help promote that sense of industry and decrease those feelings of self-control. So, some nursing interventions, again, that you can do is allow those choices, explain all procedures at their level, try to make sure the procedures are as painful or pain-free as possible. You don't want them to be painful. You want to encourage continued interaction with their peers, and that can be like doing schoolwork or talking to them on the phone. You also want to encourage the parents to participate, and also if the parents have to leave, let them know when they're going to return. Um, and then, you can use visual aids and concrete words to describe what will happen. Keep in mind, they may need some tutoring if this is going to be an extended illness to help keep up with their schoolwork. So, in this stage, children are looking at, as far as Erickson's stage, that industry versus inferiority. So, they keep in mind they have success, and that's achieved by mastering that skill and knowledge. Exploring stressors for hospitalized adolescents. You have to keep in mind, they have a fear of body image, body changes, loss of that independence, that control, that privacy, and, as well as, the separation from their peers, their home, their school. So, if a patient is wanting a friend to visit, you definitely want to encourage that. So if they're not wanting friends to visit, that's going to be a potential developmental problem. If they withdraw from peers, that could also be a potential developmental problem. Adolescents are preoccupied with the appearance and body image, and that's very paramount for that age group. Nurses who respect the adolescent's desire to have privacy and independence is often successful in establishing that trusting relationship. And then, that also assists in helping the adolescent to cope with the hospitalization. So these kids still need to feel in control. And they need to make sure that they are in active participation in decisions in the plan of care. Some responses to hospitalization can be denial, regression, withdrawal, intellectualization, projection, displacement, anger, frustration. So some nursing interventions that you should be focusing on are education and explanations and allowing them to express their feelings and thoughts. You want to allow them to be an active participant in decisions in their care and allow flexible visiting hours. So it may not be uncommon for an adolescent to be more concerned about their physical appearance than on their actual physical problem or illness. If they have an illness or injury affecting their physical appearance, it is likely to be the bigger stressor. So, keep that in mind. Um, you know, Also something else, that you may may need more flexible feeding schedules. You might see some irritability. You want to try to have the parents there. You want to attempt to maintain a routine with a quiet environment. And again, make sure those procedures are as pain-free as possible. So go ahead and review the question and see what you feel like the answer is going to be. Then you can pause the audio and I will tell you the answer. So the answer would be B. Adolescents are developing their identity and rely most on their friends. They're concerned about their appearance and how they look compared to their friends. About the patient and how they react. So think about siblings. There is also stressors for siblings of the hospitalized child. You have things like there's daily routine changes and fear they'll be forgotten or neglected because their sibling is ill. They could respond with aggression, anger, regression, jealousy, resentment. So some nursing interventions that you can do to help siblings are to explain, what's going on and, make sure you're explaining it appropriate for their age level. Allow them to visit and encourage parents to spend time with the other children as well. I want you to go ahead and read the following question and determine what your answer will be and pause the video and then I'll give you the answer. So the answer is A. The child with cystic fibrosis has something that the younger children does not have. Cystic fibrosis brings the affected child more attention than others. And even if the parents make efforts to spend more time with the siblings of ill children, the well child will be jealous because the situation can never be equal. The 6-year-old child doesn't understand the complications of the disease and only sees the 11-year-old as being treated differently. Question. Read it, figure out your answer, pause the video or audio, sorry, and then I'll give you the answer. The answer is C. It is not uncommon for older siblings to have bad thoughts or wishes towards a new sibling. They must be assured that their thoughts didn't cause the infant's death, and the understanding and acceptance of death depends on the child's developmental age. The children will express feelings of concern about where the infant is, the loss of the infant, and expression of parental grief. Family responses to hospitalization. Some stressors include role changes, disruption of routine, fear of the unknown, missed work, additional expenses, and not being kept informed. Some responses will depend on the experience with illnesses of the child, shock, anger, disbelief, and guilt. Some nursing interventions that you can do would be to connect them to support groups, communicate with them, and provide resources. Preparing children for procedures, keep in mind the procedure or the preparation may begin a few moments or days before the procedure. You're going to use developmentally appropriate techniques. So think back about, children and their developmental levels and where they are and what things you can use to teach them. And then you want to always make sure that you use words that the child can understand. And you want to allow the parents the choice to stay. So you can go back and review your textbook. There's a table that pertains to assisting children through painful procedures that will give you very specific information based off of the type of procedure and the developmental age. Think about performing the different procedures. Again, we talked about this a little bit earlier. Generally procedures are performed in a treatment room. You want to perform them as quickly and as efficiency as possible. You want to utilize nursing staff to immobilize the child, not the parents. So don't ask the parents to help hold the child down. You want to, find some nursing staff to help with that. You want to allow the child to scream and cry. And then you want to give the child praise after the procedure. So again, you take them away to a treatment room so that their room is a safe place. And you don't want to have the children or the family or parents, hold them down or anything like that for painful procedures. So here we have a slide that talks a little bit about a medication administration. So you should have done some ATI modules about medication. So just keep in mind, orally, if they're over 5 years old, they're usually given or less than 5 years old, sorry. It's normally given in a liquid form. You want to avoid putting it in their bottle if they're an infant. You want to crush tablets and mix them in a small amount of applesauce or something that the child would prefer to eat. You've got your topical medications. You want to make sure and use only the prescribed amount and cover, you might have to cover that area as well so the child doesn't get into it. Sub-Q, you want to make sure you're rotating and documenting those sites. You want to use a very small gauge needle for administration. The site of choice for intramuscular is going to be their vastus lateralis because the gluteus maximus muscle is not recommended. And then intravenously, you want to make sure that you monitor that site very, very carefully and maintain it. The sites can be in their hands, their feet, their scalp, veins, especially in infants. So keep those things in mind. Safety in medication administrations, you want to assume the young child will be uncooperative. Never leave medication at the bedside. Always label your syringes. To prevent aspiration or choking, do not give medication to a child that is crying or an infant that is crying. Always double check safe dose range for the child's weight or mass body index. And then you want to have 2 licensed nurses check any high-risk medications and follow the rights of medication administration. So some medication administration tips. Don't ever call medicine candy. You want to compliment the child. Only allow choices when they exist. You can also use distraction. Involve the parents. Mix medication with the smallest amount of additive because often they'll spit it out. You want to try different administration devices as well. IV therapy pumps are used with these pediatric patients. There's very specialized pumps for smaller children. So, we use these to prevent too rapid infusions or incorrect infusion rates and volumes, fluid overload. And, these IV fluids must be delivered through a reliable electronic IV infusion pump. So you always want to have 2 RNs to double check the settings, double check the IV site, make sure it's patent before you start the IV therapy. And if the child becomes fussy or inconsolable, you always want to check that IV site. Maybe it's infiltrated or the catheter has become dislodged. If you look at the next slide, that is going to show you the most common IV set that you will see attached to the pump. When we talk about starting peripheral IVs on pediatric patients, you want to use gentle restraint methods. Gather all your equipment before you start. You want to select the cannula size appropriate for the child's vein. Generally, that's a 22 to a 24 gauge needle. You may have to insert it in the scalp if they are less than 9 months of age, in the feet if they're not walking. So you want to always check for pulses to make sure that it's not an artery when you're doing that. You also want to protect the site and check it often. So, oftentimes we secure with soft gauze wraps and use an arm board if needed. So when selecting an IV site on the scalp, keep in mind that these are babies. This may be their first haircut. So if you have to shave some of that hair or remove some hair, make sure that you save that hair for the parents. Sometimes children require urinary catheterization. It may be to collect urine or it may be for another reason. So as you can see, the catheter sizes vary, with preterm being the smallest of 5, going all the way up to school age and adolescence, anywhere from 10 to 12. We think about urinary catheterization and specimen collection skills. Keep in mind that, with infants, you might place a collection bag or a straight cath an infant for sterile UA. Young children, you can ask them to use the bedside side commode and assist with a clean catch UA. And with older children, you can provide verbal instruction to collect the clean catch midstream specimen. Keep in mind the minimum urine output in children is 1/2 to 2 mils per kilograms per hour. That is a formula that you will need to know. This is a clean catch urinary specimen bag here in the picture. When children need oxygen, there's a couple of different delivery systems that we use. We may use nasal cannula, so that is for low to moderate concentrations of 1/4 of a liter up to 4 liters per minute. Sometimes these are difficult to maintain on small children and might need tape or transparent dressing. Humidification is needed for flow rates anything greater than 4 liters per minute. We also have oxygen hoods and tents. This provides high oxygen concentrations for infants up to 100%. With this, you want to monitor for CO2 accumulation, and they must be removed for feedings and care from this tent. Pediatric suctioning. The purpose of this is to remove secretions from the mouth or nose or to clear the airway in children. Some of you may have seen a suction bowl before, and then also there's olive tips and sterile suctioning devices. A lot of times infants are sent home with the suction bulb from the hospital. We're going to talk about strategies to promote coping and normal development. Child life programs focus on the psychosocial needs of the hospitalized child. Professional specialists plan activities to provide age-appropriate playtime for children, either in room or in a playroom. Sometimes it is to work through feelings. Activities can include playing with medical equipment, acting out procedures or treatments on dolls, using games to act out feelings, or drawing pictures about treatment. Therapeutic play is play that presents the opportunity to deal with fears, concerns, stressors, and healthcare experiences. There's also a table in your textbook that talks more about this. Therapeutic recreation is having contact with peers and adolescents. So that can be using phones or video games, movies, game rooms, and physical activity. So keep in mind when preparing for discharge, it is started at admission. So you want to assess the family's ability to care for the child. And what about, do they need childcare? Because the parents are going to have to return to work. Assess if any adaptations to the home is necessary, possible arrangements of any individualized education plan or an individualized health plan may be needed. So you might have to work with the school district for re-entry into school. There may be a formation of an IEP, which is an individualized education plan. They might need tutors. You also want to teach the parents how to use equipment, and have parents identify symptoms of distress and when to report them to their health care provider. Some of these kids may also need physical therapy, speech therapy, occupational therapy, maybe transportation. So you have to start at the beginning and start when they're admitted and work through all those things and make sure that you have all of those things in place before they are discharged. So that is the final slide in this set.